I'm Dr. Sridhar. I'm a nephrologist practicing at Manipal Hospitals, Vijayawada, Andhra Pradesh since 2013 with around 10 years of experience in this field. I hold a DM degree in nephrology from Sri Venkateswara Institute of Medical Sciences, Tirupati. And today's topic for discussion is chronic kidney disease and its association to pedal edema, and what are the various stages of chronic kidney disease, what are the various symptoms of chronic kidney disease, and what are all the various treatment options available for pedal edema in chronic kidney disease. So let me start with the definition of chronic kidney disease. Chronic kidney disease, by definition, is an irreversible reduction in glomerular filtration rate below 90 ml per minute per 1.73 meters square. The glomerular filtration is nothing but a calculated one, and there are various formulas available over the net. But out of this chronic kidney disease, EPA equation, CKD EPA equation, as endorsed by the National Kidney Foundation and KDIGO guidelines, is the best one to calculate the estimated glomerular filtration rate. So chronic kidney disease is an irreversible damage of the functioning nephrons. We all know that there are two kidneys in the human body which filter all the waste products, the uremic toxins or the solutes, and they keep the body fluids in a well-balanced state in terms of electrolyte composition, acid-base balance. And importantly, the kidneys contribute to the red cell production by producing a substance called erythropoietin. And kidneys also contribute to the bone mineral density or the bone mineral strength. So these are all the various functions of chronic kidney disease. Whenever the kidneys start failing or whenever a person develops a chronic kidney disease, depending upon the stages of chronic kidney disease, the various clinical manifestations they develop. Chronic kidney disease can be staged into 5 stages depending upon the estimated glomerular filtration rate. Glomerular filtration rate 60 to 90 ml per minute per 1.73 meters square. Glomerular filtration rate 30 to 60, 15 to 30, and less than 15 ml per minute per 1.73 meters square. These are the GFR stages under which the chronic kidney disease is described into 5 stages. Chronic kidney disease stage 4 and stage 5 are very important in terms of development of clinical symptoms. Chronic kidney disease stage 5 is nothing but an end-stage renal disease. In this stage, initiation of renal replacement therapy is inevitable. So what is the importance of chronic kidney disease? See, most of the patients, they do not develop clinical features unless they reach chronic kidney disease stage 4 or stage 5. So this is very alarming. Why? Because many of the patients, they actually don't know that they have developed chronic kidney disease unless they are tested regularly. Importantly, patients who are already have hypertension, diabetes, family history of kidney disease, genetical diseases like polycystic kidney disease, they should be evaluated from time to time for the development of reduction in glomerular filtration rate. So what are the various clinical manifestations of chronic kidney disease? Chronic kidney disease has multiple systemic manifestations. Don't think that it's a disease of one organ. Chronic kidney disease has implications on each and every system of the body. For example, if you take the central nervous system, patients may develop reduced intellect, reduced thinking capacity, disinterest and decreased orientation. And as the disease progresses, they develop a state called uremic encephalopathy, seizures, and frank coma. Also, they develop various neurological and musculoskeletal manifestations. And if you take the gastrointestinal system, they may have decreased appetite, aversion to food, nausea, vomitings as the chronic kidney disease progresses. If you take the hematological system, as I have already discussed, kidneys, they produce erythropoietin, which help in RBC production. So as the chronic kidney disease progresses, the erythropoietin synthesis will be reduced and they develop anemia. And there can be various bleeding manifestations. There can be thrombotic tendency. And importantly, the topic of today's interest, they develop fluid overload state or pedal edema. If the edema worsens, next stage they develop pulmonary edema and they may land up in emergency initiation of hemodialysis to remove the fluid that got accumulated in the lungs. And if you take the bone mineral disease, CKD related bone mineral disease, they tend to develop fractures and they can develop avascular necrosis of the hip. And sometimes they develop cardiovascular manifestations like hemorrhagic stroke, ischemic stroke, congestive cardiac failure, or acute coronary syndrome. So these are all the various clinical manifestations of chronic kidney disease. And most importantly, edema. As the CKD progresses from one stage to another, they tend to accumulate fluid in their body. So how this edema, how we know that this patient is developing edema? If you look at the patient's legs, there can be a shiny skin and the limbs may be swollen and the face may be swollen, and they tend to have pits or dimples when you press the skin for a few seconds. This is called pitting pedal edema. In the initial stages, the patients may not have manifestations like shortness of breath. However, as the edema progresses, the fluid tends to get accumulated in the lungs, especially after 4 to 5 hours of sleep. The patient gets up from the bed in view of development of shortness of breath. So this is the stage of pulmonary congestion or pulmonary edema. So how do you manage this edema? Initially, we advise patients to limit his or her salt intake to 4 to 5 grams per day. To limit his fluid intake to less than 1 to 1.5 liters per day. If the edema is still worsening, then we may have to advise him to limit his fluid intake to less than 700 to 800 ml per day. And the next stage is prescription of diuretics. There are various diuretics which help in treating edema. Importantly, loop diuretics, thiazide diuretics, and aquaretics, that is tolvaptan. So these three are different classes of diuretics which help in treating edema. Out of this, the loop diuretics are the most powerful ones which help in relieving edema. However, these loop diuretics should be taken very cautiously. The dose, the titration, the frequency, everything should be in accordance with the prescription of a treating physician or a nephrologist. There are a number of side effects with this diuretics if they are not used properly. First and most importantly, over judicious uses of diuretics or over uses of diuretics sometimes may jeopardize the fluid balance state and the patient may develop hypotension, worsening of renal failure. And the second thing is development of electrolyte abnormalities like hypokalemia, hyponatremia, and most importantly, resistant to diuretics. Suppose if the person is not adherent to his or her salt or fluid intake, even if you prescribe proper dose of diuretics, they may not help in relieving his or her edema. So along with diuretics, strict adherence to dietary and fluid restriction is very, very important. And next thing is, what are the causes for edema in chronic kidney disease? Or as far as the kidney is concerned, why the patients develop edema? In the process of worsening renal failure, as the filtration capacity of the kidneys decrease, the patients tend to accumulate sodium and water. This is the first important thing in chronic kidney disease patients. Second thing is, even though the patient doesn't have reduced glomerular filtration rate, like in nephrotic syndrome, where there will be a lot of leakage of protein in the urine, this leads to depletion of the serum albumin, the albumin stores. So this leads to transportation of fluid from the intravascular compartment to the extravascular compartment because of hypoalbuminemia. So this is a state of relative hypovolemia. The kidneys sense that there is a drop in the blood, that is blood or blood volume that is coming to the kidneys. So they sense it's a state of relative hypovolemia. So they tend to retain more of sodium and water in the body. So this is a cause for edema in nephrotic patients. So in both these scenarios, we will tend to prescribe diuretics. The dosage should be gradually titrated. The patient should be monitored for development of postural hypotension, electrolyte abnormalities, worsening of renal function. And sometimes we may have to add a thiazide diuretic half an hour to 1 hour before loop diuretic to enhance the efficacy of loop diuretics. This is called a sequential blockade. So in a nutshell, reduced glomerular filtration rate in case of chronic kidney disease and hypoalbuminemia in case of nephrotic patients. Both these contribute to development of edema. So we usually advise salt restriction, fluid restriction, and judicious prescription of diuretics. And sometimes we may advise limb stockings, limb elevation also. And importantly, chronic kidney disease is associated with n number of systemic manifestations. So it amounts to, it has various clinical manifestations right from central nervous system to cardiovascular system, hematological, bone and mineral disease, as well as a gastrointestinal system. So with this, I conclude my presentation. Thank you.